If you can hear this breath sound, the lung is already sick. Vesicular versus bronchial breath sound. Explained in 2 minutes. Stay till the end. Breath sound aren't just noises, they are clues. Today I'll show you how to instantly differentiate between the vesicular and the bronchial breath sound like a pro. Let's start with the normal vesicular breath sound. They are soft, low-pitched and rustling like a wind through the leaves. Inspiration is longer than the expiration in the ratio of about 3:1. And remember, there is no pause between inspiration and expiration. These sounds are produced because the lung tissue filters and softens the air movement. When is the vesicular breath sound reduced? Just remember, air not reaching the lung properly or when the lung is overexpanded, which is seen in conditions like asthma, tumors, pleural effusion, emphysema, and lung collapse. Now let's go to the bronchial breath sound. These are the real red flags. They are loud, high-pitched, harsh, almost like air blown through a pipe. Inspiration is short, expiration is long or equal. And yes, there is a pause between them. These sounds mean the lung between the bronchus and the chest wall is solid or airless. There are a few types of bronchial breath sounds: tubular, cavernous, and amphoric. Tubular is seen in conditions like pneumonia, collapsed lung with open bronchus, and cavernous is seen in the thick wall cavity. Amphoric is a metallic sound in the smooth wall cavities, pneumothorax, bronchial fistula. So if you hear bronchial breath sounds on the chest wall, always suspect consolidation until proven otherwise. Save this for exam, share with your study partner, and follow for more such clinical shortcuts.